Hi, I'm Dr. Janine Hopkins, board-certified dermatologist. I'm here at the FFAS meeting with my colleague, Dr. Deirdre Hooper. Hi, Deirdre.
Hi. How are you?
Great. How are you today?
Doing great.
So we've had a really great morning. We've been listening to different lectures by dermatologists and plastic surgeons on facial aesthetics. Dr. Hooper gave us a great discussion earlier about potential complications and pitfalls, but mostly we've been learning about how to enhance the facial areas for aging and rejuvenation. So Dr. Hooper, what do you think has been your best pearl you've learned so far?
So you gave a great tip on brow position, and when you want to look at a woman's brows and decide what's the best way to make her look more beautiful and enhance her beauty, you need to look at the brow in the context of her facial shape.
Exactly, right.
So I thought your tip was really great. So you said when someone has a more oval face and you want to round out their face, you might want to make their brow point a little wider.
Right, more arch to the brow. And then particularly with someone with a long face, it's important that they extend the brow tail out more laterally so it helps balance their facial features. So it was really fun preparing for the discussion on how to enhance the brow, because I did need to study and learn really how it fits the face, the framing of the face, and the symmetry. So it's really important.
Right. I thought that the talks were really good, and I thought it was so great the way this meeting combines plastics and derm, because I think it's a synergy. Because I think that plastic surgeons can contribute some anatomy that we maybe are not operating at that level, and then the dermatologist can talk about skin care and skin quality and how if you move skin, you're not necessarily enhancing
exactly right. And I was honored to be on a panel with 3 of the plastic surgeons and give my little input as a dermatologist on really what we do to address skincare concerns and how to prevent some of the aging effects that occur. So specifically, like for our millennial patients, protect and take care of your neck so that you age better in the long run. So you gave a great talk too, Dr. Hooper, on the forehead, and I think people really just don't appreciate some of the changes that can occur on the forehead and how it affects their whole face shape. So would you give us a few more tips on kind of how you evaluate someone and what your technique is for injecting the forehead?
Absolutely, because I completely agree. I think that when you look at facial aging, people sometimes focus on the lower half of the face, because as your face sags down, you look at wrinkles in the lower half. But if you address the upper face, you're going to look more naturally beautiful. And what happens to your forehead as you age is that it becomes flatter. And in women, you want your forehead to be slightly convex or flat, but certainly not indented. And you'll see this in women. And so their brow looks prominent, which masculinizes their face, or they just don't have as pretty of a light reflection. And so my talk was just about using product deep on bone safely to enhance that curve of the brow.
Well, it was a great talk, and your technique was wonderful using the cannula. So it was great, and I feel honored to be here today with Dr. Hooper, learning more tricks and tips for our specialties.
Absolutely. Thanks for having me.
Thank you. Great.